The fifth year students who are there for the entire year, they rotate through 4-week blocks in paediatrics, O&G, and 2 mixed integrated GP rotations. Some of those integrated weeks also have a day on the ward with the ward doctor, and on Fridays in the paediatric block, the students have an anaesthetic day. They go through each block once, and then in second semester they repeat them again.
So I'm currently on one of the GP placements. So I get to go to Quorn twice a week with Dr. Tony, who's really well known around here. And on the Mondays I get to go to Pickawea, which is one of the Aboriginal health clinics here. Most of the practices we go to allow us to do some parallel consulting. They've set it up really nicely here. We get our own room. We'll see the patient first and then give a brief handover to the doctor and go from there.
So it kind of depends what placement we're on. Every one of our placements are all quite different. At the moment I'm on paediatrics, so we usually start the day around 8:30, so we get to the hospital, we do a ward round, and then we head up to like the old main building for clinic. Depending on the days, sometimes clinic goes all the way through to 5 o'clock.
Twice a week we have afternoon tutorials which are run by the Rural Clinical School. So they run on Zoom. We come here to the Learning Centre and we'll dial into the Zoom session with all the other rural sites. We'll have some really valuable teaching by clinicians in the various fields of our subjects. So whether it's human reproductive health, rural medicine, general practice, geriatrics and paediatrics as well are the main topics that we cover this year.
The day-to-day of being the clinical academic is preparing education material for the students based on what they want to learn and tailoring it to their specific needs, along with them presenting cases and interesting things that they've seen along the way. It also involves supervising them in my role at the hospital to do shifts with me on the ward, seeing patients and doing procedures.
So as the Director of Clinical Training, I'm responsible for coordinating our team of rural generalists at the Port Augusta base, and their role is to provide remote clinics out in the far reaches of South Australia. So for one of those clinics, they will hop on a plane and fly for 1 to 2.5 hours to get to their clinic destination.
So I went on a few flights. The highlight was this thing called a bush run. We flew around to all these stations right up north, the north of South Australia. We went to 11 or 12 different stations, stayed the night in William Creek, so flew around the whole north of the state, which was cool. And also got to go to Yalata 4 times. One time got to stay overnight in Ceduna as well. But it was good because I got to go back to Yalata a few times, so I saw patients that I'd seen on previous visits and then got to see them the next week.
So Port Augusta is a little bit unique, so we each get our own unit to live in. So the 5th years who are here for the year get their own unit, and it's in a complex that other rotating 5th years come through. There are also 4th year surgical students who come through there and some 6th years as well. So there's always different people to chat to. So even though you're living by yourself, it's a very community-based complex. So it's good you kind of get your own space, but then, you know, if you want to go hang out, there's a common room and you can just go into one of your friends' houses as well. So
living in Port Augusta is really good. It's like a nice sized town. It's not too big that like you don't know everyone, but it's not too small. So there's still like lots of things going on. There's lots of different places to go and different things to sort of see and do. I've really loved it here and the community's been great. And it's so good that we're so close to the Flinders Ranges. They're just like literally on our doorstep, but we're also close to like the Eyre Peninsula and pretty close to Adelaide. So if you do want to go back for like an event or something special, it's not too much of a big deal to go back. You can kind of just drive back in an afternoon.
Honestly, it's like been such a wholesome year. We've come here, people have looked after us, people have really taken us under their wing. We've really got ourselves involved in the community. So, for example, at the start of the year, we were going to the swimming pool quite a lot. We were doing park run, and then during winter, we each joined a netball team as well. And we just met heaps of people during the town, going to the local gym as well. There's such a nice community there. I'm actually going to cry when I leave Port Augusta. Like, we've met so many nice people here and they've really taken care of us. Clinically, it would just be having developed more autonomy to be able to see patients on your own. come up with a management plan, present that to the senior, especially in the emergency department. That exposure's been really great for practice.
See, the RFDS is a pretty keen thing and lots of students are keen to be involved in that. And it's a great iconic placement for them to go and see how it works. You know, Flinders Ranges in our region, magnificent, beautiful bushwalking experiences. We've got Pitchy Ritchie Train. We try to do that once a year as well, the students and myself, which we really find a good bit of fun. And it's just a great place for them to come, get settled and enjoy the company of the other students who come by.
I think just take every opportunity that you get. Doing rural fifth year is such a unique opportunity, and I've definitely learnt a lot more getting more hands-on. Being able to have that mindset of, you know, I'm here to learn and I want to take every opportunity that I can has really helped me to get the most out of this year.
I think it's really a good idea to develop a good relationship with your supervisors. If you're a bit distant, then you won't quite get potential exposure to all the opportunities that you could. Whereas if you're really active and engaged and asking lots of questions and asking to be involved, then they'll involve you heaps and they'll invite you to different clinical experiences. They'll even invite you to their house for dinner, which we have done a few times.
So if you're coming on a rural placement, see it as an adventure and as a chance to really find out everything there is to do in that place that you're going to. Immerse yourself in the town, get involved with whatever you can find. And even if you don't normally play sport, get involved in a sport or go adventuring, go hiking. I've noticed that the students, and I remember from my own rural placement days, some of those experiences are the best ones of my life. The friends that I made that I still catch up with now. And I can see that happening with the students that we see here as well.
For many, it's the first time they've met and engaged with Aboriginal people. They enjoy their culture and storytelling. I believe people who haven't met Aboriginal people, haven't been to remote Aboriginal communities, will certainly get the surprise of their life. The opportunity to interact with Aboriginal people, Aboriginal health organisations, is a privilege and it should not be missed.
%, yes, absolutely. I am convinced it's the best site to come for placement. Personally, our site's a little bit different, so we have a bit more of a 50-50 split between hospital and GP. We get to go to the RFDS for a month throughout the year, which is just amazing and so unique and something that, you know, we'll probably never get another chance to do in our career. There's visiting specialists that come up, and I honestly just have nothing bad to say about it. I think the placement is amazing, you learn so much, and the community is amazing, and it's such a nice place to live. So close to the Flinders Ranges, you know, just 10 out of 10.
Port Augusta is really great, and we're also really lucky we have Kerry, who's an incredible student coordinator. She looks after us and she's always, like making sure we make the most of our time here, and she's so organised, so she keeps us all really organised too.
Go Port Augusta. Yeah, that's all.